neurosis disturbs neurotransmitter production, producing mood disturbances, trouble concentrating, reduces hormones, estrogen and testosterone. This is a study published in the Archives of Internal Medicine showing compromise to the immune function due to chronic stress. Increased metastasis, suppressed natural killer cell function, increased vulnerability to infection, more asthma, more atherosclerosis, increased clotting, and acceleration and progression of diabetes. This was a study done and published in the Mayo Clinic Proceedings in 2000. 840 medical patients were divided based upon questionnaire into two groups, optimists, pessimists, and there were mixed group. Pretty much similar numbers. Then they followed these groups for 30 years. 86% they were able to follow. The optimists were living a mean of 19% longer than pessimists. So the meat, so to speak, of this lecture has to do with your mind. The problem with the human mind is 80% is unconscious. Some people call it the shadow. The conscious mind is where you think, where you contemplate what you're going to do, where you have the thoughts that only you listen to. The unconscious mind is the major part of the human mind. This is a graphic. What is contained within the unconscious mind is all of the emotions that a child suppresses in order to survive childhood. If a child has a painful experience and they're only 3 days old, if they're left in the hospital because they're sick and they are abandoned to some degree, mother's not there, child has emotional pain of abandonment. Because the child is only a few days old, that emotion is automatically suppressed. Infants, even intrauterine infants, are feeling. They know what's going on with their mother and to some degree with their father. They are sensing the world through their mother. They are only feeling and they're not yet thinking. Any emotionally intense experience, whether it's anger, fear, sadness, grief, sorrow, at these early ages is automatically suppressed. The example that I give, and you've heard before, is the little girl with an alcoholic father. She's 2 or 3 years old. She hears the violent behavior in the house. She hears yelling and screaming, sometimes violence towards siblings or mother. The child cowers down. The emotions going on inside are automatically suppressed because children suppress emotions in order to survive. It's like a soldier who stumbles across a horrific battle scene will block it out of his mind. This is ongoing during those first 7 or 8 years of life, and it's ongoing throughout life. But the emotion is not gone, it's just stored in the unconscious mind. So what happens to the little girl with an alcoholic father who comes home every night and terrorizes the family is that later on in life she will grow up with her own variety of emotional wounds. The only way emotional wounds can heal is to create circumstances in her life that would allow the feeling to come up and be released. That's called emotional wound healing. Every wound in the body, from stubbed toes to cut fingers to emotional wounds, have a healing mechanism. And the healing mechanism for emotional wounds is to unconsciously influence and create life experience so as to create a circumstance that would let this previously suppressed emotion come up into consciousness and be released. So at the age of 25, the woman who had an alcoholic father is very likely, based on scientific research, I should get this data, I'm sure it's around somewhere. She is very likely to attract an alcoholic boyfriend or husband, because at the age of 25, now she can let the anger, tears, and sadness out, whereas she couldn't do that when she was 2 or 3. In releasing the feeling, it's termed the natural therapeutic experience that David Biscott wrote about extensively. If she cries her tears, she realizes that anger is an emotion that is useful to set boundaries, to say this is not okay to do this now. She couldn't do that when she was little. If she discharges her fear, anger, her sadness, then that traumatic experience has been a healing experience. If she does not express her feelings because she learned in childhood that little girls aren't supposed to be angry, or she decided unconsciously to hold in her feelings because emotions are too intense, too dangerous, she doesn't express feelings, then there is no healing, and she runs from this fellow, blaming him, and she's likely to do it again, sometimes again and again and again. This is a very important, this is a key issue of mind-body medicine. Basically, you create your life experience. If you create a wonderful life experience that's full of joy and happiness, so be it. Congratulate yourself and enjoy it. If you create a painful experience, then that too is created by you, not consciously, but unconsciously, so you can discharge the emotion that's coming up in you and eventually come to the place of mastery in which you say, thank you for the experience, because it brought me to greater self-knowledge by making the unconscious mind more conscious, which I believe, and others, that this is the essence of the spiritual experience, is to make the unconscious mind conscious, called self-realization. So basically, contrary to what we're taught in our society, nobody is a victim. Nobody. Everybody, at all ages, are creating their life experience in co-creation with those around them. This is kind of hard to wrap the head around sometimes. Anybody have any comments on this?
It's not easy.
Right. It's one of these tools. It's a tool. You can't always, it's such an immense paradigm-shifting tool that you may not, it takes a while. Just consider it a tool. And you're going to, if somebody gives you a powerful tool in the workshop, in the shop, you're not going to really understand it until you use the tool. So using this tool means that I'm going to observe my experience, and when something occurs that is unexpected, painful, brings up emotion in me, I'm going to use this tool and see where it takes me. Then you will see. I got this tool from a teacher who was a very powerful teacher, who could see the unconscious mind, who could see the wounded aspects of self. And I have tested this tool on myself extensively, and I've listened to patient stories extensively. And truly, it is a very useful tool. But it's a paradigm-shifting tool. It means that you are no longer a victim. Nothing in your life occurs because of some dark outside force. Everything in your life is occurring because you're creating it, but you're not creating it consciously, key point, but you are creating it unconsciously in co-creation with those around you.